and welcome to Open, the show that opens the Bronx and the rest of the world to you. I'm Brittany Aubain, and today we'll update you on what's happening in and around our borough. Coming up, the Bronx Economic Development Corporation has announced the People's Choice Award in Healthcare for 2024. We are joined by the borough president to speak more about this amazing award. Then, the Alabama Supreme Court has ruled that frozen embryos can be considered children under state law. A fellow with Physicians for Reproductive Health and maternal fetal medicine physician in New York speaks to us more about this ruling. After that, we take a look back at an interview with the Senior Industry Analyst for Bankrate, who spoke with us on how you can now transfer money in a 529 savings plan for non-educational purposes. And finally, since 2019, Children's Aid has operated a network of food pantries in the Bronx to meet the nutritional needs of the students and families we serve. We are joined by the Deputy Director for Bronx Community Schools at the Children's Aid to learn more about their efforts to support the students of the Bronx. So stay tuned, all this and much more is headed your way because we're now officially open. Hey everyone, I'm Brittany Aubain filling in for Kibben Aline, and today is Tuesday, March 19th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. For the second time in Bronx Week history, the Bronx Economic Development Corporation is accepting nominations for its People's Choice Award. This year's award will spotlight healthcare workers, with one recipient set to be inducted into the Bronx Walk of Fame. Nominations are being accepted through Monday, March 25th. To be eligible for the People's Choice Award in healthcare, nominees must have either been born in the Bronx or have strong ties to the borough. Joining me now to speak more about this amazing award is Bronx Borough President Vanessa Gibson. Borough President, thank you so much for joining us.
Yes, thank you for having me today on my birthday.
March
Yay!
19th, happy birthday.
Pisces season.
Love that. So, we're celebrating your birthday, and soon enough we're going to be celebrating Bronx Week, which this year's new edition is our Healthcare People's Choice Award. So tell us a little bit about that.
So we are excited for the second year in a row to host Bronx Week 2024, but to really announce the People's Choice Award. And this year we're going to spotlight a healthcare hero or shero, someone who resonates leadership, exceptional service to our healthcare industry, to patients and residents of our borough. And nominations are open, and we're asking residents of our borough to weigh in on who their healthcare hero is, who their healthcare shero is, who has really done exceptional work, gone above and beyond the call of duty, recognizing that our heroes and sheroes do this work every day. During the pandemic, we saw them on the front lines, risking their lives just to keep us safe and healthy. And we lost so many during COVID-19, and they forever remain in our hearts. And the healthcare workers need support. They need pay parity. They need to work in dignified, respectable places. We need to make sure we have more nurses and recruiting more nurses and other healthcare professionals. So we're very excited, and I want to recognize President Rob Walsh and the BXEDC team, Julian Drake from Bronx Tourism Council, really the entire team. We're very focused on Bronx Week 2024.
I think this is such a great award. If we look at the timeline, it was 4 years ago, just around this time where COVID-19 was this global pandemic, and it was a state of emergency. And like you mentioned, there were so many healthcare workers who didn't see their families for months, who unfortunately that we lost because of the pandemic. So can you just elaborate on why it is so crucial to continuing honoring our healthcare heroes even after 4 years?
I think it's always important to recognize them because they do the work every day without the accolades or the recognition, and they're always on the front lines. Healthcare is the greatest investment we can make because so many families need quality, affordable, and safe healthcare. They need wraparound services. They need trauma-informed care. We need healing spaces. We need to deal with trauma and mental health, children's mental health. We need to deal with behavioral health and primary health care, making sure that every family has access to primary health care. And so many families do not. They're underinsured, they're uninsured, they don't have Medicaid or Medicare. Older adults need to be supported as well as they're aging. We need to take care of veterans. We need to take care of our children. We have so many health disparities in the Bronx when it comes to being number 62 out of all 62 counties across the state, as determined by the Robert Wood Johnson Foundation. So we have to do better. We've made great strides and progress in certain areas, but we still have a long way to go. And I want to recognize Bronx Health Reach, Charmaine Ruddock, the Institute for Family Health, our own Bronx Health Link, Shirley and her team that do phenomenal work around maternal care, investments in birth workers, doulas, midwives. We want to make sure that we build out a Bronx birthing center for all of our birthing individuals, because African American and Latino women are 3 to 4 times more likely to die during childbirth. It's unacceptable. We have some of the highest rates of asthma, heart disease, obesity. We need to make sure that when we talk about healthcare, we talk about food equity, food justice, because they all go hand in hand together.
And to be eligible for this award, nominees must have either been born in the Bronx or have strong ties to the Bronx. So as the borough president, what do you consider having strong ties to the Bronx, and what does support in the Bronx look like?
Right, so we have a lot of our healthcare workers that are not necessarily natives of our borough, that are not born here, but they have either been raised here, they have been here for many years, 15, 20, 25, 30 years of a presence living in the Bronx and working in the Bronx, specifically working at one of our health and hospital institutions, our public hospitals, our FQHCs, our school-based health clinics. All of that is eligible, whether you are a physician's assistant, a CNA, you are a nurse, you're a certified nurse, you're a doctor, a physician, some type of skill set that's in the medical field. We want to recognize that. And I think allowing the residents of our borough to weigh in on it is something creative and innovative. The People's Choice Award. And last year, I want to recognize that the first ever People's Choice Award was in education, and we were able to induct Principal Luis Torres from CS 55 in School District 9, who's also the president of NYSESPA, the New York City Elementary Schools Principals Association, great leader in the Claremont area, Morrisania area, and he was our first inductee through the People's Choice Award. And now his name is enshrined along with 120 plus other Bronx natives and other influential leaders that have served us, whether it's sports, it's healthcare, it's acting, it's music, it's art, it's entertainment. I mean, people like Fat Joe, Remy Ma, SWV, Jennifer Lopez. I can go on and on about so many incredible pillars that have really done amazing work and continue to give back to our borough.
I think this is such an exceptional concept because, yes, we have, like you mentioned, all of our celebrities on the Walk of Fame, but there's also the people who are still in the Bronx, still living in the Bronx, that are really helping do the work to help the residents that are here.
Right.
So let's just talk a little bit more about the fact that the winner will be honored with a place on the Bronx Walk of Fame. Let's once again just elaborate on that significance of the Walk of Fame.
So once we receive all the nominations on Monday, March 25th at 5 p.m. is our deadline, we will go through it internally and have our staff look, and then we will see which nominee has the most number of votes, right? And that person will receive a notification. We usually do a big surprise at their location. So a healthcare hero, so we may go to the hospital, the healthcare center, the FQHC, and we will let them know that they are the winner of the 2024 People's Choice Awards in the area of healthcare, and we will give them the details for the actual unveiling, which is Saturday, May 19th. Saturday, May 18th, along the Grand Concourse. And it's a beautiful ceremony in which we induct others, because we do have a process where we are honoring other Bronx natives, and that will be the People's Choice Award inductee, Bronx Walk of Fame 2024, along the Grand Concourse. And we're also digitizing the process. We are working closely with BXCDC. We got a grant through the state, and we're going to transform the look of the entire Bronx Walk of Fame along the Grand Concourse. You're going to have QR codes where you can just take a photo, and you can actually bring up the entire profile of all of our past luminaries that have been inducted. We're always looking for ways to be more creative in our work and really make sure that the Bronx Walk of Fame continues to bring energy. It started back in 1997 under then Borough President Fernando Ferreira. So I do want to recognize that all of my predecessors, Adolfo Carrion, Ruben Diaz Jr., have carried and continued that tradition. And now with the People's Choice Award, I think it's something different that allows residents residents of the borough to weigh in, because at the end of the day, this is their borough, and we want them to have a say in who's inducted into the Walk of Fame.
I think that's just, so, again, just such a great concept, such a great idea. So when it comes to selecting a nominee, what are some things that you think Bronx residents will be considering or thinking about when it comes to their healthcare hero?
More likely personal choices, their favorite doctor, their favorite OB or GYN, their children's doctor, their pediatrician, so many different factors I think that people will look at. Who has been instrumental in their own life? It could be a friend, it could be someone that they've met through work, through their professional career. It could be someone that works at the local healthcare center, a friend that they have gotten to know through the hospital setting. So I think it's a variety of things, and that's why we give a lot of latitude, because we don't want to be too restrictive where you're not able to pick someone that may fit in that category. So we allow a lot of latitude, a lot of options for Bronxites to come up with their favorite healthcare hero or shero. And I do want to recognize, when you think about the healthcare industry, let's recognize that many of our healthcare workers are women and women of color. They are the nurses, they are the social workers, they are the dietitians, the clinicians. They are the ones that have really been doing this great work. And sometimes they don't always get recognized. They don't get that thank you and that award all the time. And that's what we want the People's Choice Award to do. We want it to highlight someone that doesn't always get the recognition, but that has been doing the work behind the scenes and really been in the trenches when it comes to healthcare. They are saving lives every day, and they are reminding people that in their greatest hour of need, that someone cares and someone is there to help them through their journey of healing and restoration. They could be a victim of a crime or domestic violence or gender-based violence, or anything can happen. They can have an injury or an illness. They can become disabled. There's so many parts of healthcare that we recognize, so that's why we give that flexibility to allow residents to really come up with who their healthcare hero and shero is.
Yeah, I think being able to recognize our healthcare workers is so important. And you know, there are a lot of them that say, well, you know, I don't do it for the praise, which is admirable, of course.
Absolutely.
But it is also important to give people their flowers when they're doing such amazing work like this. So the Bronx Walk of Fame is just one of the many events that happen during Bronx Week. This will actually be my third Bronx Week with BronxNet. And in the past, we've seen some staple events, and then we see some events that, you know, kind of interchange throughout the years. So can you tell us what do we have to look forward to with this Bronx Week?
Bronx Week 2024 is going to be bigger and better than ever before. It starts on Monday, May 6th through Sunday, May 19th. And we are returning the annual Bronx Arts and Carnival Festival and the parade back to Marshallou Parkway. Despite a lot of just concern about the concourse, many people wanted it back on Marshallou, so we are returning there. Our infamous Bronx Ball is going to be Saturday, May 19th. We always have a health fair. We have an event honoring our centenarians who are 100 years of age and older, right? And we also have a veterans event. We have an event dedicated to educators. We are adding a new event that's going to focus on small businesses, working with BXEDC. It's going to be like a little competition where the best business can earn up to $10,000 in prizes and awards, and we're very excited about that. We also have an event that is obviously dedicated to health, as I mentioned. So we have a roller skating party usually. We have a silent disco. We're very excited about that. And we have a business luncheon where we recognize our businesses and labor leaders as well that are in the labor industry. It's essentially 11 days of just nonstop Bronx, everything Bronx. This year, we're also celebrating the 110th birthday of the Bronx that was founded in 1914. So we're working with our new borough historian, Angel Hernandez, and we're going to have an event around that as well, because we want to celebrate the Bronx. This is the one time where we get to highlight everything that's good about the Bronx. Despite a lot of what we hear and read about, there's amazing things happening in the Bronx, and we want to amplify that. The children, the families, the seniors, the voices of the people of this borough that live and work here, raise their families, that do business, that want to make sure that they see all of the fruits of their work. Bronx Week is everything Team Bronx. We are one Bronx. We are a global destination. We are a cultural entity. We are a beacon of just so many different opportunities, being the largest park that we represent, Pelham Bay Park. We are the greenest borough. We have Orchard Beach, also called the Bronx Riviera. We are the birthplace of hip hop. We have so much going on, and we want to celebrate that during Bronx Week. So for more information, I ask everyone to please visit our website, which is www.ilovethebronx.com. And that's THE, not DA.
You
The
know,
Bronx.
I think that's so much fun. You know, there's something for everybody. And so with that, Borough President, I want to say thank you so much for joining us.
Thank you. Absolutely. Bronx Week coming up.
To learn more about the Bronx People's Choice Award, go to www.ilovethebronx.com. Don't go away. We'll be back with more Open right after this.
I remember when the Bronx did not really have a media outlet properly representing the people of the Bronx.
BronxNet provides for the community by being a community where people can be empowered to share their voices.
We are in a really great place technologically. We've got all the resources that we need to be effective.
Whether it's through cameras, storytelling, editing, we have provided those services for 30 years.
BronxNet's mission is to be a voice for the community.
To educate, to inform, and to inspire.
And you can be a part of it. We've built studios for you.
Welcome back. The Alabama Supreme Court has ruled that frozen embryos can be considered children under state law, a decision critics say could have sweeping implications for fertility treatments in the state. The decision was issued in a pair of wrongful death cases brought by 3 couples who had frozen embryos destroyed in an accident at a fertility clinic. Justices citing anti-abortion language in the Alabama Constitution ruled that an 1872 state law allowing parents to sue over the death of a minor child, quote, applies to all unborn children, regardless of their location. Joining us in studio to speak more about this ruling is a maternal fetal medicine physician in New York and a fellow with Physicians for Reproductive Health, Dr. Erinma Ukoha. Doctor, thank you so much for joining us today.
Of course, thanks for having me. So excited to talk to you and your audience about this.
Thank you. So to start off, can you provide a brief overview of the recent ruling in Alabama that considers frozen embryos as children under state law?
Yeah, no, thanks for that question, because I think a lot has been going on in Alabama, like you summarized, and it's important to consider this recent ruling in the context of everything that's been going on with abortion restrictions and anti-abortion laws. So on February 16th, the Alabama Supreme Court ruled that frozen embryos have the same right as people in the state of Alabama. And we immediately saw the impacts of this as IVF, in vitro fertilization, clinics closed, and patients no longer had access to that care. Then subsequently, on March 6th, the Alabama legislature then passed a rule protecting providers, protecting physicians who perform assisted reproductive technology from prosecution, from criminal prosecution or civil legislation as it relates to providing this care. So providers who perform IVF are protected, but at the same time, the rule still stands that embryos have the same right as individuals do.
So when it comes to this issue, can you tell us a little bit more about where do Physicians for Reproductive Health enter this conversation?
All right. So Physicians for Reproductive Health, also known as PRH, is a physician-led advocacy group that focuses on using the voice of medical providers, physicians, to advocate for reproductive health, reproductive rights, reproductive justice. And we know that this passing in Alabama is all based on anti-abortion rhetoric. It's the same playbook. They've been using it for decades, and now we just see the implications directly as it relates to fertility care. And so, as physicians for reproductive health, we believe that individuals should have the right to make decisions regarding their bodies, regarding their families, based on what they feel is best and with the support of medical providers, not restrictions imposed by state laws.
Absolutely. And can you tell me, from a medical perspective, what implications do you see in designating frozen embryos as children?
Right. It's concerning from a medical perspective because it's not based in science. There's no evidence that supports that, and we know that it's not about patients, it's not about individuals. This comes back to lawmakers wanting to have control over people's bodies, trying to control anything from abortion to now fertility access. And we know that it's based on this concept of fetal personhood. And so that's been used time and time again to criminalize pregnant individuals and to place abortion restrictions.
Yeah, and we're kind of seeing this fear being taken over with, autonomy potentially being taken away with things like abortion and IVF restrictions. And this fear is also playing into women seeking reproductive health care, not just in Alabama, but on a broader scale. So how does this ruling affect that?
Right. And from a broader standpoint, the ruling just shows the climate, the political climate, and it shows that that same anti-abortion rhetoric is now impacting all of reproductive health. And so it's going to increase surveillance of people who try to use, whether it's IVF, whether it's access abortion, access pregnancy care. We're talking about increased surveillance for these populations, and we know that particular populations are always surveilled by the state with more scrutiny. And so that's Black and brown communities, individuals who use drugs, people from low income communities. And so those people are at even further harm.
And so also, how does this ruling, while we're talking on a broader scale, how does this ruling impact individuals' autonomy over their reproductive choices?
Right. It's a shame because this ruling really negatively impacts that. If you're not allowed to decide when and how you want to have a family, the right to have a family, the right not to have a family, this is infringing on your reproductive rights, on your human rights, on your rights as an individual.
Yeah. It's just such an insane topic to talk about. When you think of these are things with my body potentially being taken away from me, it's scary. It really is. And so given your role as a maternal fetal medicine physician in New York, can you speak to the potential impact of the Alabama ruling that it may have on women's reproductive health within the state of seeking IVF treatments?
Right. Thankfully, New York is a protected state, so we have a government, we have lawmakers that support our right to bodily autonomy, and we see that the legislation reflects that. But I think more broadly, it speaks to what is a focus on a national level in different states at a time where the U.S. continues to have worsening health outcomes, at a time where maternal morbidity, mortality is on the rise, where we see more abortion restrictions being passed, and now the focus is on frozen embryos and different ways to restrict that. I think it shows that Alabama doesn't have the well-being of their citizens at mind.
Yeah, absolutely. And when it comes to approaching these conversations with patients in New York about these types of rulings, how do you help ensure that they are informed and supported in their reproductive health decisions?
My main role is to make sure patients are, like you said, informed and supported. So make sure that they're educated, a lot of reassurance as it comes to New York and what's available and what's protected, and a lot of also empathizing with that legitimate fear as people think about what might change, what's to come, how does this affect how I decide to build and plan for my future family. So it's a lot of discussions about that and just trying to meet people where they're at and make sure they have an understanding of what's going on and what it means.
Yeah, I like how you brought up kind of having that sympathy and that empathy, because sometimes as doctors, there's maybe this idea that, you don't get too close, you don't get too attached. But at the end of the day, when this is coming to people's lives and people's autonomy, you can only help but so much, and you can only feel, you can only detach yourself so much, because you begin to put yourself in that person's shoes. And what if that was me? What if these decisions that I do not want are now being, forced upon me?
Right.
So I think that that's a great idea to have, and a great method of speaking with patients. And so, with that, what advocacy initiatives or strategies can be employed to challenge rulings that may impede reproductive rights, and how can medical professionals contribute to these efforts?
Now more than ever, we're seeing the importance that abortion can't be siloed off. It can't be seen as separate from reproductive health because those same tactics, those same rhetorics are used to control access to all sorts of reproductive and sexual health. So that's from abortion, from pregnancy care, contraception, miscarriage, and fertility. And medical professionals, we now more than ever, have to just speak up. Speak on a local, state, federal level, and talk about why this is important and why this matters.
Absolutely. And how do you prioritize and center the experiences and voices of patients in shaping advocacy strategies and initiatives?
So patient voices and experiences in particular are always at the center of this. I think we can't do this work without being a meaningful relationship with individuals, without engaging community and really understanding what the needs are. And so as we discuss how do we move forward, how do we better the care, and how do we get people what they need, it's all about lifting up the voices of those that are most marginalized, making sure that they have a platform.
Absolutely. And when it comes to these voices, can you kind of just give us maybe just an overview of what are some of the conversations being had, amongst people? Like, what are people's fears? What's the kind of feedback that we're hearing?
From a patient perspective, a lot of what I'm hearing is, first it was abortion and people having to travel out of state to get that. Now it's IVF and fertility care. What else? What comes next? I think it's a fear of the unknown and looking at what's being targeted as it comes to reproductive and sexual health care.
Yeah. And so how can healthcare organizations ensure that their services are inclusive and sensitive to the needs of individuals from diverse backgrounds, including those who may be directly impacted from restrictive legal measures?
The first step is always listening to, like you said, to those most impacted, making sure listening and being sensitive and figuring out how do we close that bridge and get people the resources and the access that they need. And a lot of times it's also reflecting on what's the harm and the violence that's perpetuated by the healthcare system as an agent of the state. These disparities, the inequities that we see in healthcare are not happening in a silo either. And so how do we begin to undo that harm and mitigate that harm in communities that are affected the most, so low-income communities, Black and brown families?
Absolutely. And let's talk about how can education play a role in countering anti-abortion rhetoric and fostering a more comprehensive understanding of reproductive health decisions?
Education is going to be the first step to seeing that what tactics are at play, what the anti-abortion rhetoric is, and the agenda, and understanding and putting it into context to what's going on now. And so I always want to make sure patients and providers alike are well informed, have an understanding of what's going on, and understand what could come next. And that's important as we try to gain back these reproductive rights, try to stop policies that infringe on reproductive justice.
And what are some of the resources that people can look at to help educate themselves?
Physicians for Reproductive Health is a great resource. But we always have up-to-date information about local, state, federal rulings, and I think just staying in contact with locally what's going on from local elected officials, and then on a national level, there is definitely a lot. So the nice thing about PRH is that all that as it relates to reproductive health is consolidated there.
Absolutely. And can you also just tell us, looking ahead, what strategies do you think will be crucial for medical professionals and advocacy organizations to safeguard reproductive rights and autonomy in the face of evolving legal landscapes?
As we're working together on this, and I think it's always done in collaboration with community, understanding that we have this shared goal, and then figuring out how can, as physicians, we use that position of privilege that we have to then speak up, say abortion, make sure abortion is at the forefront of those conversations. Whether you provide abortions or not, understanding that it's part of sexual and reproductive health, and that's important to all people.
Absolutely. Dr. Ukoha, this is such an important conversation to have, right? So I want to thank you, just for sharing the resources, sharing where are some different places you can get educated. And I think this alone in itself was a very educated conversation. So thank you so much for that. And thank you for joining us today.
Thanks for having me. More than happy to be here.
Of course. So to learn more about the work that Physicians for Reproductive Health does, please go to their website at www.prh.org. Stay tuned. We have more open for you right after this.
Thank you, BronxNet. Congratulations on 30 years. What an amazing accomplishment. On behalf of myself, Alina Dow, and I represent the Dow Twins and the Dow Twins Show, who are young producers. They started, I think, when they were 11, and now they're 14. They started making 30-second little fun facts, and now they are doing 30-minute shows. And it goes to a testament of how much you guys do in the Bronx to make young people want to continue to be involved. I wish you 30 more amazing years and beyond. Thank you for what you do.
Only 57% of New York City high school students are college ready by their senior year. "55% of high school graduates either have no plans to attend college or are uncertain that they will ever attend. "34% of young adults don't go to college because they can't afford it. Discover what's possible. BronxNet's education programs, internships, and opportunities help engage and inspire Bronx youth and beyond to pursue their passions. Be a part of the BronxNet family. Whether you're interested in our shows, joining a class, or donating to support our mission, visit BronxNet.org to learn more. Welcome back. We would like to take this time to look back at an interview with Ted Rossman, who is the Senior Industry Analyst for Bankrate, where he helped explain how the 529 savings plans can now be transferred for non-educational purposes. Let's take a look. Thank you so much for joining us once again.
Of course, thanks for having me.
Now, for those who are unaware, can you please give us a little bit more details about the 529 savings program?
This is basically a tax-advantaged college savings program. So the way it works typically is that you're not going to pay federal or state taxes when you take out money that's a qualified distribution. So basically you put it in there, you do pay federal taxes on the front end, you get a state tax break, but then the real advantage is when it comes time to take the money out, you're not going to be taxed on those distributions. So the idea is this money grows over time. Later on, you take it out for college tuition or room and board or other qualified, often higher education expenses, and then you're not going to have to pay taxes on that money. So it's sort of a double win. There's the tax advantage, but there's also this discipline of saving and investing and encouraging people to put this money aside for the future.
Now, can you explain how it actually works? Because I'm very curious, is it parents or guardians putting maybe like $10 a month into an account? How does it actually work?
It could be, yeah. I mean, it could be amounts that small. It could be somewhat larger amounts as well. But yeah, it's kind of like your workplace retirement plan where the idea is to periodically put more money in. So you could actually set up an automatic transfer. That would actually be a great idea that, every paycheck you have some money put into this 529 plan for your kids or grandkids, and then it grows over time. Slow and steady can win the race when it comes to some of these longer term financial goals. And I often point out that with retirement, for example, every dollar you set aside in your 20s or 30s might be $30 or $40 by the time you retire decades later, just because money grows in the market. And for college savings, it's probably not going to grow quite that much because you have more of a constrained time frame. But hey, I mean, if you have a young child now, maybe they're not going to college for 15 or 16 or 17 years. I mean, you can get a lot of gains here. So there's the tax advantage, but there's also the fact that, look at it this way. If you're getting a 10% return, which is pretty typical historically in the stock market, your money's doubling roughly every 7 years. So I know that college costs are going through the roof, but one way that we can fight back against this is by saving and investing early and often. It doesn't even have to be huge sums to make a difference.
Now, this seems very beneficial to, any of the recipients that are in the program. What do these funds actually go toward?
You could use this for tuition, room and board, books, computers, really a wide variety of education expenses. In New York, it's focused much more on college. Some states actually let you take distributions for K to 12 education, like for private school, for example, tuition. In New York, that does not have a tax advantage. It was kind of left open to the states to decide whether or not to opt in and out. So for New Yorkers, I would say we should think about this as a college retirement or a college investment vehicle.
Now, when should a parent actually begin looking into the savings program, especially if this is something maybe that they're just hearing about for the first time?
It's kind of like that proverb about the best time to plant a tree was 20 years ago, but the second best time is today. I think early and often is the name of the game if you can. Now, I understand that money is tight and a lot of people, unfortunately, are having trouble meeting day-to-day expenses. And you think about college and it's like, whoa, that's just, not attainable. I would stress that every little bit can count. So, do what you can. There was a recent change that actually eliminated, I would say, one of the barriers to saving and investing, which is that some people worried that if their child doesn't go to college or maybe wins a scholarship, that this money is then wasted. Because if it's not used for qualified higher education expenses, then there's a penalty. So there's a 10% penalty, plus you're taxed on all the earnings. That has been a deterrent for people. That barrier has been removed to some extent. So actually starting this year, if you have unused 529 funds, they can actually gradually be transferred into a Roth IRA retirement plan. So there are limits. You can only convert up to $35,000 lifetime, and you can only convert up to $7,000 a year if you're under age 50. But still, I do think this has removed one of the potential barriers to saving and investing.
So you brought up something that I thought was very interesting, which was age, because people finish college at any age. Is that one of the restrictions or one of the limitations that if you're over a certain age and maybe you haven't used the money yet, are you no longer able to use it? Can you kind of maybe go into some of those details?
There are some things you can do there. So there's not an age limit on who can use these funds. So if you're somebody who maybe has been in the workforce in a while and then goes back to school and you have access to 529 money, you can use that. It's also very easy to change the beneficiary. So, if you have multiple children and maybe the oldest didn't go to college or maybe they got a scholarship or they didn't use all the money, you can change the beneficiary and use it for another child or potentially even grandchild. So, that part is very flexible. The key, though, is qualified education expenses. And in New York, higher education expenses. That's the main barrier. It's not necessarily the age or the person, but I think some people don't realize that you can transfer to other children or grandchildren or even yourself.
Now, you kind of talked about the changes that were coming to the plan. How does this change benefit families who actually have the 529 savings plan?
I think it has two main benefits. The first one is that it opens up more uses for this education money without the penalty. So the fact that you can convert that into retirement, savings, and investments, that's valuable because we know a lot of people are undersaved for retirement as it is. So it's kind of a double win there. So I think that is really important. And just at a time that all these costs are going up, I think that eliminating some of these barriers to entry is definitely important. Because some people say that they're not contributing just because they worry that, what if I'm going to end up paying the penalty because my kid doesn't go to college or because they got a scholarship. The fact that now you can convert this into a retirement plan is useful. Again, though, it's not all at once and it's maybe not the full amount. I mean, you do need to be mindful of some of those limits, like that $7,000 a year limit for most people and the $35,000 lifetime cap. But I think it's still a step in the right direction.
So that was going to be my next question. With this change, would you still recommend maybe a parent or a guardian who is looking to, looking into the program? Is this still something that is worth taking a look at?
I think it is, definitely. Yeah, I think that the tax benefits are important, but I think also the discipline of routinely saving and investing, I think is really beneficial. So I do think 529 plans are useful. New York has a good plan that has that state tax deduction. So if you're a single contributor, you can deduct up to $5,000 a year in state income. If you're married filing jointly, it doubles to $10,000 a year. So there is that tax advantage on the front end. There's the tax advantage on the back end where these qualified distributions are not going to be taxed. But I also think just sort of this future look is really important, similar to retirement savings. I know it may feel far off, but I think it's sort of twofold. I think it's the tax advantage, but I think it's also just getting started because you don't really want to time the market. You want to have more time in there, and over a 10 or 20-year period, there's a very high likelihood that those contributions will rise in value substantially.
Now, I'm curious to know, how could this program help families who struggle with financial literacy, or, could it maybe bring up some challenges for families who struggle with financial literacy?
I think it's one of these things where a little bit now can turn into a lot later on. That idea that with a 10% annual return, your money is doubling every 7 years or so. I mean, if you start when your child is born or soon thereafter, you might have 2.5 of those doubling periods by the time they go to college, maybe even 3 by the time they finish college. So, in that sense, money is accumulating more money. And then you throw in the tax advantage, and that is a further benefit. So I do think it's a good idea to get started early if you can. I mean, even if it's only 25 or $50 a month or a paycheck. Maybe you can also look to bump it up over time. I think like your retirement savings, sometimes there's an element of you don't miss what you don't see. So if you get a raise or every few months, maybe you can try to bump up that contribution.
Now, how can those who are interested create one? And what are the steps to doing this, especially if you have multiple children?
nysaves.gov is the New York State 529 plan website, so it's easy to sign up there and get more information. We also have more information at Bankrate about 529 plans and the importance of saving for college. There's sort of multiple schools of thought with multiple children. One is if you do have just a single plan, you can change the beneficiary later on. So like if your oldest child doesn't use all the money, you can just easily change the beneficiary to another child, and then it's kind of as simple as that. There are, though, sometimes benefits to having separate accounts because it does keep things maybe a little more organized, so you know exactly what each child has. But also with this conversion we're talking about where unused funds can be transferred to somebody else, the account for that purpose has to be open in that person's name for at least 15 years. So that's actually a good reason to have separate plans if you have separate children.
Well, I want to thank you so much for joining us and having this conversation. I definitely learned a lot, and I hope the parents and guardians out there have definitely learned a little bit from this segment. So thank you so much.
No problem. Thank you.
We'd like to thank Ted Rossman and the team at Bankrate for working with us and helping us inform our viewers of these changes. We have to take a quick break. We'll be back with more Open after this.
The ability to have my show during this time is helpful because I can stay connected with my friends, still interview people, and share my content.
Hey everyone, it's your girl Kat from the Kitty Rose Lifestyle, also from The Next Chapter, where we discuss shades of gray every week right here at BronxNet, Saturdays at 11 p.m. Wow, 30 years. 30 years of BronxNet public access television. I'm a girl from Brooklyn and came to the Bronx 25 years ago, started my journey on BronxNet on public access television in 2016, and BronxNet is where I got my start. BronxNet, I feel like, is a home away from home. They support all of my endeavors, and I wouldn't have been able to be on any of the other channels if it wasn't for the fundamentals that I learned right here at my start here at BronxNet. So I am so appreciative. My son says I should stop telling people I'm from Brooklyn because I've been here now, Bronx Strong, for 22 years. So I'm so grateful, and I wish you much success in 30 years, 30, 30, 30, 30, 30, 30, 30, 30 more, because public access is necessary so that people like myself can have a voice. Yes, BronxNet, it's your girl Kat from Kitty Rose. Check me out every Saturday at 11 p.m. right here, Channel 68, The Next Chapter, where we discuss shades of gray. Mwah.
Welcome back. Since 2019, Children's Aid has operated a network of food pantries in the Bronx to meet the nutritional needs of the students and families we serve. Their Charles Drew Campus Food Pantry serves 3 schools, IS 219 New Venture, Frederick Douglass Academy, and Knowledge and Power Prep Academy. It opened in 2021 in partnership with Food Bank for New York City. Ron Cope, the Deputy Director for Bronx Community Schools with Children's Aid, joins us now to speak more about their efforts to help serve the students of New York City. Ron, thank you so much for joining us today.
Thank you so much for having me. I'm super, super excited about this opportunity.
We're excited to have you here. So let's get into it. What sparked the creation of the Children's Aid?
I think the reason that we thought about food pantries is that we understood that food insecurity in the Bronx was something that was very challenging for our families. And then we realized that it was exacerbated by the pandemic. And then what we realized and was confirmed, the Mayor's Office of Food Policy does a report, and it sent it out in 2022. It's called the Food Metrics Annual Report. And it estimated that 1.2 million New York City residents were food insecure. And the highest rate of food insecurity was in the Bronx. Close to 20% of Bronx residents struggle with food insecurity. So it kind of confirmed that even after the pandemic, we were really in a situation where we had to serve our children and families better. So what we did was we looked at a strategy to build campus food pantries in schools, where in our community schools, where we look at the strengths and needs of our children every day, we could identify those children and families that are struggling with this and be able to support them with food directly in their school community. And that was really the strategy that took hold, and building a strong partnership with the Food Bank for New York City to do that.
I think that's amazing. And when it comes to the Children's Aid, one of the core missions is to support families facing poverty. So can you tell me more about this challenge facing New Yorkers?
I think we understand that Children's Aid, since its foundational principle has been to go to some of the most under-resourced communities. And the Bronx was the community that Children's Aid went to in 2000, where they started with some of the after-school program contracts, but they said, there's a huge need here. And Children's Aid saw that and said, listen, we need more resources here. So they started to build their community school strategy. We have a lot of work being done in Community District 3, where we have a corridor of services on Southern Boulevard. We have the Next Generation Center that serves teens up to young adults. We have a community health clinic there. We have early childhood programs, community mental health services. And more importantly, we saw that the place for us to be is in our community schools. And community schools in the South Bronx for us has been a place where we know we can stay connected to children and families to try to combat the impact of poverty on our families. We want to understand the strengths and needs of our families. We have a place-based approach where we're working in Community District 3 called South Bronx Rising Together, collective impact model, where we're really focusing our efforts and resources here in the South Bronx to serve children and families.
You know, I think when we talk about the school, it is one of those places that it's a no-brainer to put a pantry there, because families are always there, the students are always there. But it is so hard because schools are always cutting budgets. Unfortunately, the education system, when it comes to the funding, unfortunately, is taking a huge tumble. So I think it's really important to kind of have these third parties and these outside organizations come in and kind of help out with that. So with that, Children's Aid works with organizations to address this issue. So how did the partnership between the Children's Aid and Food Bank for New York City begin?
So this is awesome. So in 2019 was when our first pantry opened at the Whitney Young Jr. campus at 1919 Prospect Avenue. And we started in 2019. It was a vision of our community school director at the time, Jorge Bilal, to have a food pantry. And then the pandemic hit. And when the pandemic hit, it was so much funding for food insecurity. So we saw so much. Children's Aid has a health and wellness department that does food bags. It's called Food Box, where we have SNAP Ed, where we give out fresh produce, $20 worth of fresh produce to families for $10. They can use EBT or they can buy them, but it's a large bag of produce. Then we also had a partnership with Rethink Foods. Rethink Foods was a special partnership because Rethink Foods, what they did was during the pandemic, they worked with restaurants that were not able to open and use their food to make meals. And then they paid them for the meals, and then we distributed it across our schools, which was awesome.
Right.
And then we also had Meals on the Move, where we had food trucks go to the front of our schools and give out 500 meals. And then by October of 2021, those funds started to dry up. And then we started to say, what we need to do now is expand the campus food pantries. And I have to give a lot of credit to my partner at the Food Bank for New York City, Amanda Williams. She's the Associate Director for Community Partners Program. And she really was my thought partner with my team at Children's Aid to see how can we start expanding. So in 2019, we started at Whitney Young Junior Campus, 2021, Charles Drew Campus. Last year, we started at Paul Lawrence Dunbar Middle School. Next year, in this fall, we hope to open 2. One we know is opening at the Fairmont Neighborhood School on 1550 Vice Avenue. That will serve that school as well as Samara Community School. And then ultimately, CS61 will be one of our last community schools to have a food pantry. And that is our goal, to continue to expand, to be able to serve the community in the schools, because we think we have our teams on the ground that understand the strengths and needs of families, comfortable so families can come to us, not feel like embarrassed.
Right.
Because that's the bigger piece, right? We want to make sure that we're serving them with dignity, making sure that we understand that we're serving them properly, and making sure that we have the right people on the ground to do that. And Children's Aid has always been committed to having the right people on the ground to do that.
I think that's amazing, and especially the part in discussing, you know, the integrity and making sure that families don't feel ashamed to show up and do that, because sometimes that's why people don't, because they do feel ashamed. So kind of having that welcoming atmosphere, I think, is so important. But can you tell us a little bit more about your Charles Drew pantry in particular?
I'm so glad. This is a great segue. So Charles Drew Campus actually just got an additional set of funding through Feeding America and funding that was provided by Morgan Stanley through the Food Bank for New York City. And what they're doing is they're learning how to do a choice model. We have a large pantry there. So what the choice model is the client choice model is to serve people with dignity, allowing parents to tell us what they want in the pantry. We order to what they want and allow them to walk through the pantry and pick their own food. And that allows them to go in, nobody's picking them, giving them a bag. They can take their cart in, their bags, get the things that they want, and be able to leave. So this client choice model is just starting now. We're super excited about it. We think that it's going to be a model that we can replicate in other places, but we really, really believe that this is the way to do it and really learn more from this actual pilot. Think since 2021, this site has served close to 7,600 people. 3,900 of them are adults, 3,000, little over 3,000 are children. And we can't forget, many of these people are seniors. Many of our seniors struggle with food insecurity, and some of them are leading households with young children, and some of them are living with other family members. So we will continue to build this choice model. We will continue to build food pantries to make sure that we're combating food insecurity here in the Bronx.
Yeah, and you know, speaking of the client choice method, something that I found very interesting, I was reading an article back, is that you tailor the pantries to the community. So there was a specific line in there about how in a community that's more Muslim-based, you'll cut the pork and order more chicken and more beef. So can you tell me more about that and just the feedback you've received from that?
Well, asking the parents, doing small focus groups to understand what the families want. So we reduced the amount of pork that was offered, but we also serve many communities that like to eat pork, right? But we try to reduce it so that we know that we're serving the Muslim population and they understand what they need that don't eat pork, right? But we also ask about seasonings. What seasonings do you enjoy? What we have, we teach them about other things to use. Let's not use vegetable oil. Here's olive oil. So we talk about healthy choices as well. So different beans that they want. Tell us the beans that you would like. Tell us what type of, would you like oats? Would you like farina? What are the things that you enjoy, so that we can talk to parents, families about what they want and need, so that we can have it when we order.
Yeah. You know, I think that's just such an exceptional idea because it also eliminates food waste because you're going to pick up something that you're not going to eat. It's going to go in the garbage anyway. So I think having things that you're guaranteed, you know you're going to eat is a great option. And then also making these healthy food choices because once again, you know, for some people, they have to forego healthy foods for unhealthier options because it is cheaper to buy. So I think having something that not only eliminates food waste, but also promotes healthy eating, I think is really, really great. So with that, the pantry also allows students to gain work experience. Can you tell us a little bit more about this?
Oh, well, we are very, very thankful that we have great partners to work with youth development and youth employment opportunities. So we partner with the Anti-Gun Violence Employment Program out of the Mayor's Office. We've partnered with SYEP through BronxWorks and SYEP through Children's Aid's SYEP program, and also the Work, Learn, Grow program through SYEP. So these programs give young people opportunities to work in different facets of Children's Aid sites. This opportunity was for these actual students that go to Frederick Douglass Academy 3 to come down right after school and be able to work in our pantry. So they're able to work in the pantry for a couple of hours after school, even when we get deliveries, to make sure that they have everything set up for when the families arrive.
I think that's so important because as somebody who did SYEP, you know, I like the expansion that it's no longer just working in summer camps. There are different jobs that you can do that give you different experiences. You know, you're meeting all these people from different walks of life, and you're getting these different experiences, maybe things that you're more interested in the future. So I really like the idea of also just having a team of, you know, young people working with you. I think that's great. And so also, how does the pantry help to build a sense of community among the students?
I think the one thing that it does do is it also allows us to understand that we're here for them. I think the sense of community across the whole school, to make people understand that Children's Aid is continuing to bring resources when we hear what the community needs are and allow them to understand that we're here for them. Anything they need in a school community that's going to serve them, they can request, and we will work diligently to try to provide that for them. But I think also it allows them to understand that, especially students that work there, that we don't have to be ashamed. It's about serving and understanding that we tie to each child. When we know a child knows that that's a child's parent, right? They say, look, we've been through this too. And one of the students that work in there told us, like, my mom used this when I was in middle school, and now I'm in the high school upstairs. And for me to work here means a lot because I'm serving the same place that served my family. So I think those things are extremely important, and being able to do things in the community where we see a parent that comes to us a lot saying, I don't have any more money on my EBT, but I need food. How can we serve that parent? Or a pregnant parent that doesn't have any more food, or during the break, they ran out of food because the children were home and she didn't have any more food to the end of the month. So we said, okay, no problem, we'll bring food or come get food. And those are the things that are important for us to understand the needs of the community, of individual families in this community, and make sure that we can serve them.
Ron, this is such an amazing organization. I want to thank you so much again for joining us today.
Appreciate you.
To learn more about all the food pantry and Children's Aid has in partnership with Food Bank for New York City, please go to their website, www.children'saidnyc.org. We've come to the end of our show today. I'd like to thank all of our guests for joining us and you, the viewers, for tuning in. If you missed any part of today's show, you can catch the recable cast at 5 and 10 p.m. on Optimum Channel 67 and Verizon Fios 33, or watch anytime on the web at BronxNet.org. You can catch a brand new episode of Open with Darren Jaime on Wednesday and Rena Valentine on Friday. I'm Brittany Aubain, wishing you and yours safety and wellness now and always. See you next time.